What's that? My next patient's here? Oh, okay, thanks, Norma. You can send them right in. Well, hello. Come on in, honey. Well, hello, honey. So good to see you. I'm so glad you like coming here. But usually when you come here, it's because you're not feeling good. So hopefully I can help you again. What seems to be troubling you? Let me take a look at my notes, okay? I know Norma checked you in. Oh, okay. It looks that in the questionnaire you filled out that your throat's been bothering you. Yeah, it's hard to talk. And you're a little congested. Some headaches. Oh, dear. Well, luckily, I'm also an ENT, so I can check all that out for you. Yeah, of course. So you just sit back, and I'll take good care of you. I promise, dear. All right? Okay. Let me start with checking your breathing and your heart, okay? Okay. Now, just take a deep breath. That's right. And just try to relax. I'm going to listen to your heart. Okay? Yes. Okay, well, it's a nice strong beat. Let me listen to your lungs. Just breathe a few deep breaths and then normally for me, okay? Good job. And one more. Okay, now you can just breathe. No more for me, honey. Okay. Well, good thing is your lungs don't sound very congested. No. Let me just take some notes here. Okay. Let me check your pulse, all right? You just hold still. Okay. All right. Well, your pulse is at 80, and that's not bad at all, especially when you're a little nervous. Yeah. Okay. I think what I'm going to do next is put my otoscope together. And then I might do some palpitations on your face and feel your lymph nodes. Okay? Let me just put my gloves on. First, I want to take a look down your throat. That's what we'll do first. Okay, let's get this together. Okay. Oh, it looks like it's working. Good. All right. Just gonna take this little tongue depresser so I can look down your throat better, all right? Okay, I want you to stick out your tongue and say, ah. Yeah, say that again. Your tonsils do look a little swollen. It's a little red back there. Okay, let me look up your nose now, alright? Just tilt your head back. Okay. Okay, you can bring your head down now. Yeah, It does look a tad bit congested, but more like from allergies. Alright. You just relax, honey. I'm gonna look inside this ear, okay? Alright, just stay still. Besides a little bit of wax in there, it looks pretty good. I'll check the other side now, okay? Just relax, honey. That's right. Okay, well that one looks good too. Curious. Alright. I should take your temperature. Yes. Just make sure you don't have a fever, alright? Taking some notes so Norma can type it up after the appointment, okay? Yeah, honey, it's okay. You're in good hands, alright? I know we'll get to the bottom of this, okay? Okay, don't you worry. Let me just take your temperature. Open your mouth. I'm going to stick this under your tongue, okay? Hmm. 97.9. It's perfectly normal. So glad to see that. Let me write that down. Well, it's always good to see you, honey. Okay, now I'm going to feel around your face a little, in your neck, and your chest where your lymph nodes are. See if I can figure anything else out, okay? You just relax, honey. Yeah, you're doing so good. How does that feel? When I tap around underneath your eyes, your nasal cavities, your sinuses? It's okay? Alright. Let me check down a little lower here. Just checking around your, I feel your neck. just check your forehead. Around your cheeks more. And under your jaw. Okay. Your lymph nodes feel fine. None of them are really swollen. Maybe a tad bit on one side. But that's good, right? I know, it's so frustrating you can't figure out what's going on. But I promise I would help you, right? Okay. Alright. I'm going to take my gloves off. I'm going to use a little bit of this fun salve that my friend made that is very healing. It's a healing balm. It has special flowers and different healing oils in it, but it will help calm you a little bit. Okay? I'm just curious to see. If I use some of this, if it can help you a little bit, okay? Alright, well, I'm just going to rub this on to your eyes, around your nose, and also down your neck and your temples. Okay. Now, I want you to take a nice deep breath and think about anything that might be bothering you right now. Any worries you might have. Think about one of them right now, okay? Well, I check a few things, all right? Just keep thinking about that one thing. All right, let's see. Okay. Just gonna snap your ear. Okay, it's not that. Let's see. Think about the other thing now. You have a couple other things on your mind? Oh, honey, I'm so sorry. That you're not feeling good. That you have so many worries right now. But don't worry. Yes. It's gonna be all right. I'm here for you, all right? You'll never be alone. Okay. All right, I want you to think of the other thought now, all right? Well, it's not that. I'm just curious to know that maybe having a tight throat and a sore throat could be coming from some worries you have. All right, think about the one other thing. You said there was 3 things on your mind, honey? Yeah, 3 things on your mind? Okay. Oh. Yeah? All right, I want you to think of the 3rd thing on your mind that's worrying you or bothering you. Okay? All right, here we go. Chin up, honey. Chin up. Keep thinking about that thought. Okay. Yeah. Okay. You know, I can tell. Let's see. Yes. Well, there were a few changes when you thought about that. Yeah. I could even feel your throat getting tight and your jaw getting tight. When you thought about that last thing, do you mind sharing with me what it is that's bothering you? The third thing? Oh. You having trouble in a relationship? And they just won't listen to you? They want you to be somebody you're not? Oh, honey, I'm sorry. Are you speaking up for yourself? Are you afraid? Don't be afraid. Just be lovingly assertive, meaning in a loving way, speak your truth. It's so important to be true to who we are and find a gentle way. And sometimes we're really mistaken about what we think. We think somebody's actions or, thoughts or the way they look at us or something they might even say is directed right at us. And half the time it's not even that. Yeah, and even if it was directed at us, that's their problem, not ours, right? Certainly not yours. Yeah. So I can tell, because you haven't been speaking up, your throat's getting sore and tight. Yeah. Well, I have just the thing to loosen up their throat, help you feel better, and speak your truth. I have this little truth elixir that I made. Well, yeah. I made this little truth elixir. Yeah. It's my own serum, and if I just put a couple drops down your throat, you better believe you'll be feeling better, and you're going to be able to stand up for yourself, honey. Yes. And I will write a prescription for that you need to speak your truth. I'm giving you permission. Dr. Monroe is giving you permission to speak your truth and be true to you, honey. Because I know you're good and you want to bring joy and happiness to people. I know you wouldn't want anything bad to happen, so yeah, you're a good person. All right, you ready? Okay, here we go. Let's open up. All right, you swallow that now. And, I'm also into herbal healing. I'm an herbologist. Did you know that? Well, you only live once, and I want to learn as much as I can and be as helpful and the best doctor and healer that I can be. Yeah. So, I'm going to spray the spray around you, and it's going to help relieve any worries, stress. That's right. Okay, you just relax. Sit back, honey. You're doing so good. Doesn't it smell good, too? Oh, it's just divine, isn't it? Oh, I'm so glad you think so, too, dear. Oh, so how's your throat feeling? It feels like it loosened up already? Oh, I'm so glad. Oh, you're welcome. Anytime, dear. You know I care and want to help. It's best I can. Yeah, it makes me feel good to know that you're feeling better. Oh, and I'm going to give you this pretty little rose quartz heart to take home to remember how loved you are. Here you go, dear. Oh, so glad you like it. I want you always to remember how much you're loved. Let me just write a couple notes down before you go. Okay. Yes, Norma's ready for you, honey, so you can check out. Okay. Well, I'm so glad you trust me and always come back to see me to feel better. And I look forward to finding out what happened after you spoke your truth. You be proud. Be proud of who you are, dear. I'm proud of you. All right. Good night, honey. Bye.